Hello, so I'm going to talk a little bit about some respiratory conditions of the newborn. Um, Most of these probably are going to require a referral or transfer in a home birth setting. Newborns, when they show signs of respiratory distress, in almost all of these situations, um, they show grunting, nasal flaring, chest retraction, increase in breathing, tachycardia, things like that. So, for meconium aspiration syndrome, that is when a newborn aspirates on meconium. So, that's the baby's first poop, and it can happen before the baby's born. And sometimes they can breathe that in rather than like swallow it. If they swallow it, it's okay. If they breathe it in and get it in their lungs, that can be a problem. That can cause respiratory distress. It can block their lungs. It causes bradycardia, so slow heart rate, central cyanosis, all of those things that are normal symptoms of respiratory distress. They may seem limp, and this usually babies who have meconium in utero, so in the amniotic fluid, are typically 40 weeks plus or post-term babies. A referral would probably, or a transfer would probably be indicated if you cannot get the baby breathing well. Obviously, you'd be giving some oxygen in a home birth setting. You could use a DeLee catheter to try to suck any mucus or anything out of, or the meconium out of the lungs. Once they are transferred, they may do a chest x-ray or a blood gas test to see what the oxygen levels are, and then they will probably give them some oxygen, supplemental oxygen. For infant respiratory distress syndrome, same symptoms. It's like shallow breathing, fast, grunting, nasal flaring, retraction. This happens mainly in preterm babies, central cyanosis, and this is due to a lack of surfactant in the lungs, which is like a substance that helps the lungs inflate. And for this, the babies will probably go to the NICU. They'll be put on CPAP, ventilators. This can cause other complications and vision disturbance, or like vision issues, infections, things like that. So those babies definitely need to be in a critical care unit. Transient tachypnea of the newborn. This is also rapid breathing, grunting, nasal flaring. This is in like a normal gestational age, so like 37 weeks beyond. It's just whenever they have rapid breathing occasionally, and this can resolve on its own. They are going to need supplemental oxygen and a pulse ox to see what the oxygen levels are. They may, if a transfer is indicated, they may do antibiotics, and this usually resolves in 24 hours. So it's not quite as serious as the other ones, but definitely would probably require a transfer too. For persistent pulmonary hypertension, this is also for full-term babies, and this is when the arteries to the lungs are not, they're constricted. So they're constricted during when they're in the womb, because they don't need as much blood flow to the lungs. But once they're born, and if they're not getting enough oxygen-rich blood to their lungs, then that can cause respiratory distress. So that limits, because it's limiting the blood flow to the lungs. This can cause rapid breathing, cyanosis. The lungs are not inflated properly. It causes distress. This diagnosed by an echocardiogram, so it's definitely something that you would transfer for. They may put the baby on a ventilator, and oxygen. They may even have to open up the arteries with nitric oxide. This can be caused by like placenta problems, a collapsed lung, or even if the mother takes a high dose of aspirin or ibuprofen during the pregnancy, that can cause that. 10 to 60% of these babies may die. And then the 25% of the ones that do not die have developmental delays and other developmental delays caused by the lack of oxygen. So this is definitely something that you would want to transfer and get them into a NICU as soon as possible so they can get the help that they need. I got a lot of these resources online. Mayo Clinic, Merrick Manual. I will link these below. And then there was one other one that was really interesting to me. Cleveland Clinic. I will put these references in like the notes section. Thanks. Bye.